This gentleman is a few minutes after a hair transplant. He's had prior ones performed before. He parts his hair from the left side, so there's a huge degree of density across here. I've also blended across the central forelock and the right temple and the temple recessions in the posterior area as well. He was so excited, he just wanted to talk about his experience. So he's had prior hair transplants before. Tell me about your experience here.
Well, actually, I've had 3 transplants before. And when I came in here to Dr. Lamb, I got to be candid, I was somewhat nervous based on my prior experience, but I'd heard great things about new techniques and all that. So I am about 5 minutes from having this procedure done, and I can't tell you how excited I am about how I anticipate the results will be with this procedure versus what I had before. And I would highly recommend Dr. Lamb to anybody that wants to have hair restoration.
Thank you. You mentioned that you had your the last one was 10 years ago?
10 years ago.
And you said the size of the grafts looked really large, right?
Yeah, they were about the size of about half the size of a pea. And that's what and to be candid, that's what I was anticipating this to be. And as you can see, you can barely see these grafts. And there's just no question that 1 week or 2 weeks from now, nobody's going to even have any clue that I've had anything done. And that's what I wanted to accomplish.
Wonderful. How was the experience of the day compared to what you've had 3 times?
Well, even though Dr. Lamb is great, I got to be honest with you. His staff is just as great. Everybody in this facility that I worked with were absolutely best of the best, and I could not be happier with the experience I had with the staff here.
And also, we give you a little bit of sedation, unlike other places where other places are not, they're done in an office, they're not in an accredited facility. So in terms of comfort, did you feel it was better?
Another area that I was concerned about, but I can tell you, after they started doing this stuff, I was waiting on them to give me my shots and all that, but come to find out that had already been given to me, and no pain whatsoever, was never uncomfortable at all. And one more reason that if I ever decide to have anything else done, I'm coming back to Dr. Lamb and his staff.
So just to clarify, it's very different from I'm not trying to put words in your mouth, very different from a pain level and anxiety level during the procedure compared to what you had 3 times.
No question whatsoever. No comparison. This one would be by far best of the best.
Wonderful. And the reason I'm shooting this video is because this gentleman has been saying, look, I need to do a testimonial for you right now. So I thought it'd be better if I just let him speak and then interview him for some questions he may have forgotten. So thank you for that.
Thank you.
Well, we came back in the room because this gentleman said that he wanted to add a couple remarks about the medical therapy we're providing him. Go ahead.
Well, when I came here, actually about 9 months ago, they suggested that I use the laser hat and augment that with the 82F formula.
Which is a topical finasteride therapy for those out there.
Right, and I use the hat religiously 3 days a week for 30 minutes, and I put the lotion, the formula on every night. And I can tell you, everybody from my wife to my hairdresser has said, what have you done? Because I'm getting regrowth, and in fact, if you could look at the top of it, you might even see some black hair back there.
Totally, yes.
So, and at my age, and will turn 70 in a couple of months, for me to experience hair growth is just phenomenal. And I attribute that to the laser hat and the 82F formula that I'm using, and would highly recommend it for anyone.
Awesome, thank you. So we are a day out now, and the reason I'm back is I actually didn't have time to upload this video, but this gentleman was so enamored to talk about his previous experience. He was showing me some photos of his recovery, but more importantly to me is I'm just using this as a place card holder so that he can speak about it. Talk a little bit about, first of all, pain level compared to I know you don't remember 100% from 10 years ago, but pain level now compared to before.
Well, when I came in this morning for the day after, they asked me, were you in any pain? I said, what pain? I absolutely had 0 pain whatsoever. I did take, when I got home yesterday, only because I thought I was supposed to, I took a pain pill, but that was 3 or 4 o'clock in the afternoon. I was in bed by 10 or 11, didn't take a pain pill.
Did you take pain pills with your previous surgery?
Oh, absolutely.
Okay.
For probably for about a week.
Yeah, the reason why that's the case, so people know out there, is I do a lot of tumescent fluid, which is a fluid that moves the follicles 8 miles away from the nerve and blood supply. And I also, under 4.5 magnification loops, harvested your graft so that there was no injury to any of the nerves or blood supply below it. And that's why people have so little pain. And then my stitches don't go deep. And so all those things make this so much less painful. So that's what you're feeling the difference of.
Right.
Next question is, you talked about how you looked and you were very scared of the aftermath because of your previous work. Talk a little bit about what you're seeing differently today and day out compared to your previous work.
I would say the biggest difference several years ago when I had the procedure done, the scalps were very large. Some of them, they would fall off, even the next day after. So I was concerned about coming in here, what the size of the grafts were going to be, but I can barely see them. And it's so much different. I'll be candid. I thought when I had this done several years ago that I was going to what I consider to be the best of the best in the industry. But I found out yesterday that's not the case. I would absolutely recommend Dr. Lamb to anybody.
Now, obviously, it just goes without saying you're not getting paid or compensated
No.
anyway for any of these remarks, right?
None
Although you would
whatsoever.
like to be, but I'm not.
If you're offering, yes, but no, I'm not getting compensated at all. What I am getting is great treatment, and that's all I'm asking for.
Awesome. The one point is that I don't use paid models. I don't have celebrities endorsing this. There's no one on my website that got a discount for speaking or got compensated to talk about things. So if you look at other websites, there are all these paid models and you think, oh, they must be good. Well, they just paid them $100,000 or $50,000 for them to speak on their behalf. So there are no paid models. This is all uncompensated. To me, that's really authentic. It's really real. That's why on my homepage of my new website redesign, which should be launching soon, it talks about real patient, real stories. This is a real story. I didn't even ask this gentleman to speak. He just been asking me to speak, so there it is.
There is one other thing I'd like to say,
Yes.
even though I had a phenomenal experience.
Yes.
I can't tell you how phenomenal your staff is.
Thank you.
And to me, that is almost as important as the doctor himself. Because
it is actually as important.
Yeah, and I can't begin to tell you how wonderful they all were.
Thank you. Appreciate it.